I think that just gives us a slippery slope when we start legislating on something that God ordained.
In 2004, I was asked to be the spokesperson for the Coalition to Protect Marriage in Missouri. There was a new group that was being formed to support the passage of Missouri's amendment to our Constitution to define marriages between a man and a woman. And as you remember, we were being proactive here in Missouri after the Supreme Court decision in Massachusetts, where a few people in black robes imposed their will on the people of Massachusetts and said, we think that marriage means this, despite what you all, citizens of Massachusetts, think. Our legislators saw that they don't want to see that happen here in Missouri, want to give us the right to vote on what we think here is marriage. And I ended up helping organize that statewide campaign, and as you know, here in Missouri, we passed that with 71%. And we set an example for the rest of the country. 10 other states passed it in their state amendments in November, and now over 30 states have done so. Yes, I support a federal marriage amendment, and here's why. Because otherwise, we leave the control of our lives to a few people in black robes, as we've seen with this Washington court decision. They will decide what they think is best for us unless we take proactive steps and say, no, this is the will of the people. This is what we want. We have an Obama administration right now that wants to overturn the marriage, a definition of marriage. So we have to take proactive steps to say this is what we believe, and that's why I am supportive of the federal marriage amendment. I think it's the only way to stop the people, the activist judges, from imposing their will on us and throwing away what has worked and tested and time and true success definition of marriage that we've had over 5,000 years. And yes, God knew what he was doing in the beginning, I think.
Ms. Hartzler, you get to weigh in first on this one in relation to health care reform. Some argue the new federal health care reform law should be repealed. Others suggest the reform includes many positive provisions, such as prohibiting insurers from denying health care coverage to people with pre-existing conditions. What aspects of health care reform should be retained, and what aspects should be repealed?
Okay. I'm for the repeal of Obamacare and replacement with common sense reforms that will reduce costs, and that will increase access. I think the cost is what needs to be addressed, but yet with the government takeover of healthcare that was passed, it's actually going to increase the cost for each of us as individuals, increase the cost for our country. They say it's over $1 trillion, increase the cost for business, and that's not what we need. The things that I think it should be replaced with to reduce cost are common sense tort reform. I think we need to increase competitiveness across state lines so we can compete, and that'll lower costs. I think associations should be allowed to offer health care, and that'll reduce costs. I think having more transparency, more control by the patients, so we know how much a doctor's visit is going to cost. And we can compare between doctors and have more control over those decisions. Those are all common sense things. Yes, we need to also look at ways that people with pre-existing conditions can access it, but we have to be careful with doing that. Once again, increased costs. So there's things that we can do, but what was passed was, I believe, unconstitutional. It's the first time in my mind that Congress has mandated on every citizen and every business in this country that they have to purchase a private product and then stipulate what is in that private product. Now that's not a republic, that's not a democracy, that's beyond that, when we have a government telling us what to do. So we have to repeal this and replace it, and that's what I want to do if I have the honor of working for you.
Which provisions would I keep? I haven't read the entire bill. It's 2,300 pages of legalese, which references laws that were passed 30, 40 years ago. I don't know. I know Obama's not going to give up his health care bill easily. It won't happen. Now, should people who have pre-existing conditions be covered? Sure.